It's also Doctors on Air Day presented by Lake Cumberland Regional Hospital, and it's so good to have calling in this morning Dr. Joseph Eid, a general and bariatric surgeon at Lake Cumberland General Hospital. Good morning, Dr. Eid.
Good morning.
Thank you for taking time to call in and talk to us. And let's focus, first of all, on the general part of the surgery that you do. So tell us a little bit about what you do as a general surgeon at the hospital.
Absolutely. So as a general surgeon, we take care of a lot of abdominal pathologies, patients who have issues with hernias, gallbladder, colon cancers, breast cancers, another common thing that we take care of here at our hospital. So those are the things that we typically take care of. And then there's the weight loss option that is the part of the bariatrics is the second part of what we do.
And I know, Dr. Eid, over the past several years, the hospital has really invested a lot in the bariatric surgery program to take care of patients and get them healthy and better and well. So talk a little bit about what you do as a bariatric surgeon and how you're working every day to help people get healthy.
Absolutely. I think that's probably the most rewarding part of our job is, trying to walk patients through the whole pathway of them coming in to see us in clinic, with issues with like health conditions related to their weight, common things, high blood pressure, diabetes, chronic back pain, chronic, knee pain and joint pain. And then we see them and then we kind of take them through the whole process. Typically takes about 3 to 6 months for most patients. We help them kind of either lose weight before surgery and up to the point of surgery where we offer them, the two most common operations that are performed in the United States currently, which are the sleeve gastrectomy, or what we call the stomach shrinking operation, or the Roux-en-Y gastric bypass, which has been there in one of the gold standard operations for probably 2 to 3 decades now.
Yes.
Both very, very good operations, and they really help patients not just lose weight. I mean, losing the weight is definitely one of the big attractive points of this operation, but really it's being healthier and getting off your blood pressure medicines and your diabetes medicines and things of that sort.
Dr. Eid, a lot of people believe they need to lose weight, but who are good candidates for the sleeve surgery that you mentioned and these bariatric surgeries? Who are good qualified candidates for these surgeries?
Right. So I'll start with anyone who's overweight and having issues with just being overweight or has medical problems related to their weight, just qualifies coming to our clinic and seeing us even for medical weight loss options. Not everything requires an operation, right? But when we talk about patients who are good candidates for surgery are patients who what we call BMI of 35. And the BMI is just a calculation of weight over height squared. And there's a lot of calculators online if you want to check your own BMI. Actually, our website provides that too. So if your BMI is over 35 and you have medical conditions related to your weight, like we said, high blood pressure, diabetes, sleep apnea is another common one, then you qualify for these surgeries. And then if you don't have any what we call comorbidities or medical problems, but you're still heavy, your BMI has to be over 40. So those are the patients who would really benefit from an operation.
You mentioned blood pressure, Dr. Eid. How important is it to keep a check on our blood pressure, and what is a good blood pressure for a typical adult to have?
Right. So, when we talk about blood pressure, the reason why we want to keep our blood pressure under control is that it helps prevent cardiac and prevent stroke, or what we call injury to the vessels of the heart and the brain and the big arteries in the body. A good blood pressure is, and I feel like I'm speaking on behalf of my wife, who's also a family physician, but usually they target under 130, if I'm not mistaken, and that's what we're shooting for, so that patients are fairly controlled.
And you mentioned just a moment ago that for people who might be overweight, surgery doesn't always need to be necessary. So what are some lifestyle changes that people can make to get weight under control, to lose weight, and to be at a healthy weight for them? Because everybody has a different healthy weight. So what can we do organically ourselves to take care of our weight?
Absolutely. So it starts at home, right? It's eating healthier, smaller portions, and then Adding really exercise. I think all of us here are, we're pretty busy with our jobs, and our jobs take a lot of our time. Our families take a lot of our time, especially moms. If the mom's at work and they take care of kids, it can become really challenging to find that 30 minutes a day to go for a walk or to go for a run or get on a bike or even work out at home with some resistance bands or anything that you could do. You can do that consistently 3 to 4 times a week. That really adds and helps boost your metabolism, start you to lose weight. And on top of that, with the healthy living and eating healthier with smaller portions, that will go a long way. A common thing we tell our patients to do, an easy trick is to start intermittent fasting, for example, where you skip a meal, essentially, and you go about 16 hours without eating. So you have dinner at 8 o'clock at night, you skip breakfast, and you won't have a meal. You try to avoid having a meal or any sort of sugary drinks or anything that has calories till about noon the next day. And that has been shown to help reduce weight as well.
I've heard of that fasting lifestyle before. So is that really effective? Like you said, maybe having dinner at 8 o'clock and not eating again until noon the next day?
Right. Yes, absolutely. There are several studies that talk about intermittent fasting and the benefits of intermittent fasting. And we know that at least an 8-hour window of what we call calories or food intake is probably the longest you want to go, but you can even shorten that even more. I have patients who push that envelope to about 6 hours of just eating. So they'll have lunch at noon and then dinner by 6 and nothing before or after that point. And it's only water and calorie-free drinks. Sometimes they'll do that just to kind of, if they're thirsty or if they want to feel a little bit fuller.
And you mentioned exercise, of course, being very critical to our health. What about walking? Does that constitute as a true exercise? People might think just walking is not enough, but is it if we walk 3 or 4 times a week?
Yeah, walking is definitely a start. Especially if you're leading a sedentary lifestyle. It doesn't stimulate your metabolism, obviously, as true cardiovascular exercises such as running or biking or swimming even. I recommend swimming to a lot of our patients who have chronic back pain and joint pain because swimming, you offload the weight in the water. So it's easier to exercise in a pool than it is, running on a treadmill or walking on a steep incline. It's a good start, I would say, but definitely you want to aim to move a little bit more than that. You want to try to get your heart rate up to boost your metabolism.
Yes. And Dr. Eid, if people want to come and talk to you in your office about bariatric surgery, if they think they might want to consider it, talk about it, know more information, what can they do?
Absolutely. Our doors are open to anyone who would like to talk or even just have a consultation. We're located in Met Park at 30 Tower Circle, and all they have to do is call the office. They can Google our name, or they can Google my name, or they can Google our weight loss center. And the number's on there, and just call us and ask for an appointment to speak to me or one of our nurse practitioners. Robin Goff, who's our nurse practitioner, he helps quite a bit with medical weight loss as well. And they can just come and talk. And nobody's committed, right? We don't want people to feel like they're being pushed to have something they don't necessarily want to have, but they just want to talk. And it's completely okay to do that.
And Dr. Eid, how long have you been practicing medicine and bariatric and general surgery here at Lake Cumberland Regional Hospital?
So I moved down here with my wife at the end of 2019, 2020 actually. September of 2020 was my start date. So I've been here for this September will be my 3rd year here in Somerset at Lake Cumberland.
Well, we're glad you chose Somerset to be your home, and thank you, Dr. Eid, for all that you do at the hospital to keep our community safe and well and active and healthy.
Thank you. I really appreciate your time. Thank you very much.
Thank you, Dr. Eid. You have a good rest of your day.
You too. Bye-bye.
That was Dr. Joseph Eid, general and bariatric surgeon at Lake Cumberland Regional Hospital. And as he said, his office is located in Med Park there by the hospital. If you want to go talk to him, talk to his office about whether or not you would like to consider bariatric surgery or just what you can do to stay healthy and be healthy. When we come back, we'll talk with Tiffany.